Welcome back to our lesson on ketones. In this video, we are going to learn how to treat ketones. Remember, ketones form in the body when there is not enough glucose for the body to use for energy and the body starts using fat for energy instead. This can happen when there is not enough insulin to get the glucose into the body, or you are not eating enough carbohydrates to make glucose, such as when you're sick. So, what do we do if we have ketones? To treat ketones, two things are very important: getting insulin and drinking plenty of water. How much insulin you get is based on your total daily dose, TDD. TDD is the total amount of insulin you take in a day between long-acting and fast-acting insulin. You will want to think about the last few days. How much insulin have you been taking for breakfast? How about lunch or dinner? And how much long-acting insulin are you taking? You want to add all of these together to get your total daily dose. This number does not have to be exact. Just your best guess at how much you take each day. Now that we know what our total daily dose is, we can figure out how much insulin to give for moderate and large ketones. When dosing for ketones, we must make sure it has been 2 hours since your last dose of fast-acting insulin. If it hasn't been 2 hours, wait until it has been 2 hours, then recheck blood sugar and ketones. For moderate ketones, you are going to make sure your blood sugar is above 240 and give fast-acting insulin through an injection. You will dose 10% of your total daily dose, TDD. So, if your total daily dose is 20, what's 10% of 20? The answer is 2. So you would give 2 units of insulin. For large ketones, you are also going to make sure your blood sugar is above 240 and give fast-acting insulin, but this time it will be for 20% of your TDD. So, what is 20% of 20? The answer is 4. So you would get 4 units of insulin. It gets a little confusing here, but these doses of insulin are different than your correction doses using ISF. So, we will give these ketones doses instead of a correction dose for your high blood sugar number. You want to make sure you check your blood sugar and ketones every 2 hours until ketones are negative. Sometimes you can still have moderate or large ketones when your blood sugar is low or above 240. This can happen when you are sick, vomiting, or you go a long time without eating. These are called starvation ketones. These ketones still need to be treated, but it's important to make sure your blood sugar is greater than 240 before you can give insulin. Use the 15-15 rule, where you eat 15 grams of carbohydrates and wait 15 minutes to recheck your blood sugar before treating your ketones. If you are vomiting and unable to keep anything down, you want to use cake gel or glucose gel to get your blood sugar up. You squeeze the whole tube of gel into your mouth. The sugar in the gel will absorb through your cheek and you won't have to worry about swallowing anything and vomiting it back up. Please call the diabetes team if you have treated for ketones twice and nothing has improved. Also call our team if you continue to vomit or you are unable to get your blood sugar above 240.